During phacoemulsification, there are situations where the iris tissue may prolapse into the wound or the side port wound. Now, in these situations, this iris gets traumatized, and we'll see here what happens to this iris in long term once the healing has occurred. So, iris trauma in IFIS, what happens to the iris? Now, this is one individual who had intraoperative floppy iris syndrome, and patient was on alpha blockers for his prostate problem, and we can see this pupil and iris which seems boggy, and we can also appreciate that the pupillary dilatation is not perfect as desired. And this patient was being operated on for phacoemulsification for a clinically significant cataract, and we can see this surgery at the moment when the nucleus is being emulsified, and we can see that the side port instrument and the side port is constantly having the iris tissue being presented there, and this iris tissue is getting some trauma because of the deformity which is being caused by the prolapsing of the iris, and also because the side port instrument is constantly rubbing over this tissue. And this, during this process, we can see that there is some release of pigment of the iris as well, and we can appreciate that the iris is fluttering and coming out with the flow, and these things are unavoidable in these cases because with the fluid flow the iris is bound to flutter and deform and flow along to the flow of the liquid. The surgery, that is the nuclear emulsification, has been finished, and the prolapsing iris is being reposited back. And what happens to these irises, we can see this on day 1, and we can appreciate that there is some loss of pigmentation at that clock hour where this iris prolapse was happening. And with time, this is the day 7 picture where we can appreciate there is loss of pigment, and we can see the iris tissue fibers which are visible through the defect in the pigment tissue. However, the pupil is round and functional, and this is the final picture at 6 weeks, and we can appreciate that this remains there permanently as an area where the pigment and the superficial tissue is absent, and we can see the deeper fibers of the iris, and the pupil is normally functioning and reacting. Thank you.